The following is a topic overview of melanoma, presented in part to you by Andy Ashton and James Morris.
Melanoma is the most severe form of skin cancer, but not the most common. It can only affect your skin, but it also can affect your other organs. Melanoma develops when melanocytes, the cells that create our skin pigment, become abnormal and multiply uncontrollably.
This rapid divide can be triggered by an overexposure to UV rays, but in some cases it is also due to hereditary makeup. Melanoma can appear in the form of lesions on the skin surface, moles, or lumps underneath the surface of the skin.
Melanoma can be divided into two classifications, primary and metastatic. Primary melanoma follows a predictable pattern of growth through the skin layers. This type of melanoma will rarely go away without treatment. However, if caught early enough, primary melanoma is curable. Long-term survival rate is high. Melanoma is classified as metastatic when the cancer moves through the lymph nodes to other parts of the body. This includes the heart, liver, and lungs. This is considered the late stages of melanoma, where their survival rate significantly decreases.
Recognizing melanoma can be as simple as checking your skin for abnormal-looking moles, but it can also become as complicated as an SLN biopsy. A biopsy is a process in which part of a tumor or an entire mole is removed from the body surface and then examined to see if the cells within the tumor are cancerous. This process is called staging, as it determines how developed the cancer cells have become. If the dermatologist believes that the cancer has spread below the integumentary system, he will then conduct a biopsy called a sentinel lymph node biopsy. During a lymph node biopsy, the surgeon will inject a blue dye and a radioactive tracer around the tumor site. The lymph fluid carries the blue dye and tracer away from the tumor to the nearest lymph nodes. The surgeon looks for the lymph node that has the blue dye in it, or uses a detector to find the lymph node that has the highest amount of tracer. This is the sentinel lymph node. The surgeon removes this node, and a pathologist will test it to see whether it contains cancer cells.
If the sentinel node is cancer-free, the remaining lymph nodes in that area should also be cancer-free. If the sentinel node has cancer, then other lymph nodes in the area may be removed to stop the disease from spreading further. If removal of the lymph nodes does not fully rid the body of cancer, other therapy options include chemotherapy and/or radiation. The best way to prevent melanoma and other forms of skin cancer is to protect yourself from it in early stages of life. The best way to protect yourself is to follow these preventative measures.
First off, try to limit your direct exposure to sunlight. And if you are exposed, make sure you have sunscreen. Also, checking your skin every 6 to 8 weeks for abnormalities in new or odd-shaped moles can help you prevent getting melanoma. Sunscreen also plays a pivotal role in the fight against skin cancer. Protecting the skin during the first 18 years of life can reduce the risk of some types of skin cancer by up to 78%.
People who use tanning beds before the age of 35 have a 98% greater chance of getting melanoma. This presentation was made possible by ScanCancer.org, melanoma.com, WebMD, and various EBSCO host resources.